of his arm was his wife, and he was walking with great difficulty. And my wife of his wife said that Shoaib bhai, he has developed male osteoporosis. So, and I looked at the X-ray, and they said that X-ray, the radiologist, they have diagnosed him, and they have advised, some physicians have advised him testosterone. So I examined him, and I saw that he was having anemia also. So I asked for the simple investigation, and when I saw the ESR was raised, I asked for bone marrow. And somehow he went to another doctor. Then he went to Karachi. Because he was an Air Force officer, and he could have all the facilities. He was then employed in Shaheen. He went to Karachi and visited many physicians. While coming from Karachi, he developed pneumonia, and he was admitted in some hospital in Lahore also. And then again, this took about 2.5 months. He again came to me. He was having severe bone pains. So the important message which the speaker had given, that the bone pains is not a characteristic feature of osteoporosis unless they are fractures. Anyway, the physicians and the surgeons and everybody, they have diagnosed him. And then again he telephoned me, said, I am in agony, Shoaib, I can't even walk and have severe bone pains, and I get dyspnea. The dyspnea was due to anemia. So I again told him that you please get your bone marrow done. And then he got his bone marrow done from AFIP, and within 2-3 days, the hematologist, he told me that he was suffering from multiple myeloma. So this is just for the new physician who are sitting here, just please do not go on the diagnosis of a pathologist or a radiologist. Always have your own clinical history examination, then try to diagnose and try to coordinate the different symptoms and signs which are coming. So, because I was so much confused in my mind that in those 2.5 months, I asked many of my senior physicians and surgeons, how many patients of osteoporosis you have seen in male osteoporosis in 40s of age group. So that was just by the comments, and all the other lectures, they are very informative, and I really congratulate all the organizing committee and the rheumatologists for having done a wonderful work in this rheumatology. Thank you very much.
We are also very grateful for sparing time, especially when gastroenterology people, colleagues are also having conference in the same town, I believe. So thank you very much for your support you extended, especially for recognition of our subspecialty. Now there is two important announcements. One, after this session, we are all gathering for tea, so please join us. And after 30 minutes, there are going to be workshop sessions in the same hall. This would be divided into two, and we would have two parallel workshop sessions. Buses for Munal would...
Assalamu alaikum. I'm Dr. Tahira Parveen from Liaquat National Hospital, Karachi. I welcome you all in the 15th PSR annual meeting in the workshop, and I hope I'll be able to refresh a memory of yours, because I know most of you know all of these things I'm going to talk about. So my talk is about approach to a patient with joint pains. So the part one will be about how to approach it, then about the examination, and the part three is about the spectrum, and Dr. Kamran is going to talk about that. So why is it so important? Approximately 1 of 7 patients' visit to a primary care provider is prompted by musculoskeletal pain or dysfunction. So it's that much common. Many have benign self-limited conditions, and arthritis and chronic musculoskeletal disorders are the leading cause of the disability. Many are benign, but still they are being told that they have, very scaring disease. And a lot of people are going to their physician but not being diagnosed, and this leads to disability, and we are already a very poor country. We cannot afford people with disability, and occasionally they are also life-threatening. Now, how do we approach to a patient with joint pains? First, we all know that history, physical and investigation, history is the basic tool, and a systematic approach starts with a careful history and physical examination, as with any other system.